what kind of data you're getting from Yemen. There was a case reported on Friday in Hadramaut in the south. I wondered what you're getting in terms of information on contact tracing. It appears that the neighboring provinces have closed the borders. So I wondered if you've had any suspect cases anywhere else in the cities of Yemen, Aden or Sana'a or Sada, and what sort of capacity does Yemen have or not have in terms of hospital beds, medical professionals, etc.
Stephanie, we'll have to get back to you on that. We actually had a conference call with our country representative there, and I just don't have that data with me. There's been a huge amount of work going on to prepare isolation facilities, train contact tracing teams, and establish the lab facilities. And as you indicated, the lab there confirmed the first case. What I don't have is the number of suspect cases that have been detected. We only have the confirmed number here at global level, but we will certainly get that. Your concern, though, is correct. The situation in Yemen. Yemen has a collapsed health system, a very fractured health system, and a hugely vulnerable population. And the UN system is working with all sides to try and ensure that the surveillance systems that we have in place for polio, that we have in place for cholera, that we have in place for other diseases are now being fully activated to detect any suspect cases of COVID-19. Clinical care. Many health facilities are destroyed in Yemen, and WHO with partners has been delivering health care through adapted clinical pathways over the last number of years. And we will be able to deliver supportive care to patients with suspect COVID-19 and potentially medical oxygen. Ventilation is going to be a huge challenge. It's going to be a major challenge, and not just the ventilators, but more the technicians to run those ventilators. So we're also looking at how we can provide critical care to people. We do this in trauma care in Yemen and in Syria and in Iraq, and WHO with partners runs major clinical pathways for very high impact trauma in many countries, and we will attempt to do the same in Yemen. But it's not easy, as you say. It's a very large country. It's a very fractured health system, and one in which we will all struggle to provide the adequate levels of supportive care to people should the disease take off in this community.
Thank you very much. So if we all agree, can we have one more question, DG? And before we wrap up, let's go with our friend Jamie Keaton from Associated Press. Jamie, can you hear us?
Yes, Tarek, thank you very much. Let me just scroll back to my question here. Thank you very much. We're trying to, hold on one second. Bear with me one second. Okay, so how much? What my question is really about travel and about why we're seeing this outbreak in urban centers more than we are in rural areas, and I just want to see if you've got any new metrics on those fronts. So, how much does the fact that people travel so freely in places like Europe and North America with high-speed trains and cheap flights and whatnot explain why this has spread so fast to some countries? And conversely, might it be a saving grace that some parts of Africa and elsewhere are so remote, which would explain why they don't have such high rates? Thank you.
Very good point, Jamie. And I think this morning we were, our teams were actually talking to ICAO and IATA around that same issue, around examining travel flows and how it's influenced the epidemic. And certainly, I think what it reflects is, regardless of the country, all urban centres are connected around the world now. So we have a global network of urban centres, and at any given moment, you're no more than probably 1 or 2 flight connections from any other place on the planet. But that is very much centred on high-density urban environments around the world. It's almost, it's amazing to see that. And you're right, then disease then penetrating from a national, urban, highly populated centre out into the periphery is a factor of the number of people who go and come. it's a factor of how much distance and social contact there is between people in those environments. But it's also a factor of, can you see that disease? Because very often rural areas may have less sensitive surveillance systems, they may have less health services, and that's a factor as well. So is it that it's not there, or is it that we're not detecting the disease when it is there? And that's something we need to think carefully about. But there's no question that the global urban hubs that are connected by so many connections allow disease to move. How it then amplifies in those urban settings is a factor of population density. It is no surprise that the disease exploded in places like New York City, or first London became the epicenter in the UK before anywhere else. In Italy it was slightly different, but it did center around urban centers in northern Italy. I think it was the same in Spain and in other places. So yes, you are correct, and it does mean for the future that we really do need to look at urban health and public health in urban areas, and surveillance and containment in urban areas. Again, I've been positively surprised in many ways in that it's been incredible to see how urban populations have actually complied with and bought in to measures that you would not imagine people in urban settings would normally buy into. The idea that people in some of the most cosmopolitan cities in the world have really stayed at home, to me, is a credit, because you would have imagined that would have been much more difficult. And in that sense, I see hope for the future. But your point is well made. Maria, I don't know if you have any specific points on this issue.
Yes, just to add that even though we have seen some explosive outbreaks in urban areas because of just by the sheer fact that people are living in much closer quarters to one another, and this is a respiratory pathogen that spreads by droplets from people who are in close contact to one another, and also through contaminated surfaces. And so if you have people who are closer together, you have the possibility to spread it. But it doesn't have to be that way. So we have seen some very large urban centers that haven't had explosive outbreaks. And the difference is back to this fundamental approach that we've been talking about, is if you know where the virus is, and if you are able to test those individuals, you can actually isolate them, and you can find their contacts, quarantine their contacts, and the virus doesn't spread. So just because it's an urban environment and just because a virus shows up in a very densely populated city, it doesn't mean it has to have an explosive outbreak. So there is the possibility that this virus can be controlled. This is the first pandemic in history that we are able to do this. And so it is really critical that even those initial cases that come in, anywhere in the world, and there's a number of cities right now, there are a number of countries that are still seeing low levels of cases, you still have the possibility to control this. And so the quicker that can be done, the more aggressive action that can be done as soon as possible, the better the chances that you will not see that exponential growth and that outbreak taking off.
Thank you very much. We will conclude with this, and we will see you again on Wednesday. We will have an audio file sent to you, as we always do, in next hour or so, with other news from other WHO offices. And then hopefully the transcript of this press briefing will be posted sometimes tomorrow. Thank you.
Okay, thank you. Thank you, Tariq, and thank you all.